In 2025, an AI system flagged a pregnancy at high risk of miscarriage days before the first symptoms appeared. Doctors intervened, and the baby survived. A machine saw danger the human eye could not, but how did it know? Every year, an estimated 23 million miscarriages occur worldwide, a staggering 44 losses every single minute according to the World Health Organization. At least 1 in 10 known pregnancies ends in miscarriage, and after the age of 40, the risk can climb to nearly half of all pregnancies. For families, each loss is more than a medical statistic. It is an empty crib, a nursery left unfinished, and a grief that can linger for a lifetime. The financial toll adds another layer of pain, with repeated tests, fertility treatments, and hospital visits draining savings, leaving heartbreak paired with debt. Traditionally, doctors could only respond after symptoms began, once bleeding started, once pain arrived, once the pregnancy was already collapsing. But artificial intelligence is now offering a different path, one that peers into the earliest moments of pregnancy and detects signs of risk invisible to humans. In 2021, a study in Nature Medicine showed that AI could predict miscarriage with up to 89% accuracy using just early ultrasound scans. The algorithm did not look with human eyes. Instead, it measured subtle features: the contour of the yolk sac, the faint rhythm of an embryonic heartbeat, the precise crown rump length growth curve. Patterns too complex for humans became clear for the machine, turning pixels into predictions and possibilities. Beyond imaging, algorithms also analyze hormone shifts, tracking VHCG and progesterone fluctuations so small they would be dismissed as noise in a standard lab report. Other models combine genetic markers, electronic health records, and histories of prior pregnancies, building risk scores from thousands of variables at once. From Warwick University in the United Kingdom to Stanford in California and the Mayo Clinic in Minnesota, research groups are training AI on vast datasets to uncover the hidden language of pregnancy loss. The promise is extraordinary. Imagine a world where doctors can step in before the crisis, offering progesterone therapy, closer monitoring, or tailored lifestyle guidance at the very first hint of danger. Couples who have endured multiple miscarriages could finally be given something they have never had before: a warning, a plan, a chance. For some, the difference may be between decades of grief and the sound of a baby's first cry. But with every promise comes peril, and AI miscarriage prediction is no exception. What happens when the algorithm is wrong? A false positive might trigger fear so intense that parents live months of pregnancy under a shadow, convinced loss is inevitable even when it isn't. Unnecessary scans, invasive tests, and even premature decisions to terminate pregnancies could follow from data that was never truly destiny. Bias adds another layer of danger. Many AI systems are trained primarily on Western hospital datasets, yet miscarriage risks can differ across populations, environments, and genetics. A tool perfected in London may not predict accurately in Lagos or Mumbai, raising questions about global fairness and who benefits and who suffers. And then comes the deepest ethical dilemma. Do we risk over-relying on an algorithm, deferring human judgment and parental intuition to lines of code? The World Health Organization has already warned that AI in health must protect human autonomy, promote safety, and avoid bias, reminding us that these systems must assist, not replace, human decision-making. Some families already tell stories of hope, of AI predictions that led doctors to act sooner, to change care, and to carry pregnancies safely to term. They call the algorithm their child's guardian angel, a silent protector in the clinic. Others tell stories of dread, of false alarms that darkened every ultrasound appointment, that left mothers feeling like each week was borrowed time. One mother described the algorithm's red alert as a shadow hanging over the entire pregnancy, even though her child was born healthy. Doctors themselves remain divided. Some see AI as an indispensable tool. Others warn of panic, over-medicalization, and the erosion of trust between patient and physician. And yet the momentum is unstoppable. Fertility clinics are quietly adopting AI tools, investors are pouring billions into startups, and researchers predict that algorithm-guided pregnancy care will soon be mainstream. But if AI can predict miscarriages before they happen, what comes next? Will it begin predicting not only who may lose a pregnancy, but who may struggle to conceive, who may face complications, or even which embryo is most viable? The line between guardian and gatekeeper becomes thin, And the question grows louder. Are we giving families more control, or are we surrendering control to machines? So we return to that single moment, a machine whispering, "Act now." A heartbeat preserved not by instinct, but by algorithm. Miracle or manipulation? Guardian angel or gatekeeper of destiny? The choice is not only for scientists and doctors, it is for society. Do we embrace AI as the protector of pregnancy or fear it as the meddler in life itself? Tell us in the comments, would you trust AI with life before birth? And subscribe to AI MedX Revolution, because the next chapter in AI and fertility will shake the foundations of medicine itself.